My name's Nathan, I'm the Managing Director of Red Umbrella and Carecoins, and I'm joined by...
Colin Eley, I'm the Health and Wellbeing Manager for Nottingham Forest Community Trust.
We're here taking a lovely evening stroll around the beautiful city ground. Colin, obviously sport, we think a lot about physical health, but how much is sport a mental health thing as well?
I think in terms of being physically active, the kind of benefits on your body and the sort of internal workings that occur when you're being physically active all contribute to your mental health and your mental well-being. And I think your mood is strongly dictated by being physically active. There's a lot of scientific talk around serotonin levels, endorphin levels and things like that, but I also genuinely think that being physically active is about building resilience and managing anxiety and so on.
So how can football and football clubs like Nottingham Forest work with companies like Red Umbrella and Carecoins to promote mental health and well-being and start those conversations about mental health?
So we at the Trust, we talk a lot about, with our health and wellbeing programmes, health by stealth. So I think we have the power and the benefit of being able to leverage into the badge on our chest and maybe engage with an audience that might be turned off from statutory services or clinical services. They might have a stigma attached to them or feel a bit out of reach, and actually a football club and the community work we do, there's maybe more of an affinity, a bit more of a familiar face, familiar sort of organisation. So we can really start the engagement, start the conversation, and it's working with partners where we know we are not the experts in a field, but working really closely with partners where we could almost do sort of metaphorical handholds and signposting actions and social prescribing to trusted partners and community providers that we work with.
I like that idea of it's leveraging the badge, it's the reputation you have and the reach out to the community and then working with those people who have those expertise and bringing the two together. I think that's really important.
Yeah, agreed, and it's that nothing is ever going to be achieved on our own, whether you're an individual struggling with your own mental well-being or whether you're a partner trying to address it. I think the collaboration piece is key, and opening up to others and working with others, you can get the maximal amount of impact.
Why do you think that this time of year in particular, it's winter, colder weather, darker nights, it's pretty cold out here tonight to be honest, why do you think this time of year might be more challenging for people's mental health, do you think?
I think if I was to reflect on my own experience, I'm very much a summer baby and appreciate being outdoors and doing activities in the outdoors, of which the opportunities to do that are significantly limited when it's cold, dark and wet, etc. So I think there's an element of seasonal effectiveness to people's mental well-being. I also feel that there are maybe a little bit more of a heightened pressure around periods like Christmas, when there's such a lens over the family atmosphere and being with family, and some people don't necessarily have that. So when it's maybe thrust in front of you on TV or the different mechanisms where the messaging is about being together and people don't have that, I think it could also play to someone's mental well-being as well.
Yeah, absolutely. So how do you think early support, whether that's things like counselling and therapy services that organisations like Red Umbrella and Carecoins provide, or whether it's things like mental health first aid training, how do you think those early interventions make a difference when it comes to someone's well-being?
I think there's an instant a reassurance that what someone might be experiencing is not completely alien and just to them as an individual. I think that support service, those counselling services, can certainly put people's mind at ease and having that conversation early rather than someone sat dwelling with their own thoughts and their own sort of challenges. I think that can certainly help. And then in terms of the mental health first aid piece, then as we've sort of already alluded to, that whole collaborative piece, that understanding wider services that support different levels of well-being, be that physical, mental, and the people that are out in the community, the organisations that are out in the community, perfectly placed to provide that support, and being able to sort of recognise someone's challenges and supporting and signposting them into other mechanisms or other areas of support, I think is key at an early stage.
So obviously we're here as part of the Christmas Club event, looking at young people's mental health, well-being, particularly isolation and loneliness. Are there any particular key tips or messages you would like to give to young people who might be experiencing isolation and loneliness or might be struggling with their mental health?
Yeah, I mean, I think an emphasis on the fact that they're not likely to be alone, and that other people are maybe experiencing similar challenges. Again, it refers to that whole reassurance piece, that kind of connecting with others. And I guess really, it sounds a bit lame, but a tip would be to start the conversation, to start talking. And we do various different programs in the community, one of which is called Tricky to Talk, and it's not branded as such, but we like to refer it as an opportunity to talk, and a talking shop, where there's no agenda, there's no specific aim of the session or anything like that. It's just an opportunity to talk, and if the top tip could be for people to talk about what they're experiencing, would be a great first port of call.
I think Tricky to Talk is fantastic because it's that opportunity, and we talk about it at Red Umbrella Care Coins all the time, is that you've got to give people the opportunities to talk. It's all very well and saying like talk to someone, be open about mental health. We say that a lot, but you've got to give people the chance to do that. You've got to give them those opportunities. And I think going along to something that isn't structured, that is just, look, this is a space for you if you want to talk, if you want to share something, that's incredibly valuable because it doesn't have that pressure on it. It's just an easy opportunity. And again, that's leveraging the badge, leveraging that community connection that you have that's so important. So I think Tricky to Talk is just a fantastic initiative to have.
Yeah, and we don't profess to have all the answers. So again, it's about that reach through Tricky to Talk, through the club, through our partners, engage them in some activity we can provide, but also, like I say, connect them into other services and so on. And Tricky to Talk helps bring those three pieces together.
Absolutely. And then if people do need that ongoing professional support, that's where organisations like Red Umbrella and Care Coins can come in to provide that high quality professional support should they need to go to that level. So thank you very much, Colin. Appreciate that.